Myself, Dr. Vikram. Today we are here for the discussion on the topic of dental ceramics. See, dental ceramics is one of the very difficult topic and also driest topic in the entire dentistry. And also at the same time, it is very important topic because about 90% of cases in the clinical practice that we encounter are the dental ceramic basis only. That is like, see, suppose the patient is going for the root canal treatment, followed by they have to go with a crown, right? So the crown is going to be ceramic crown. So there, in the orthodontics, that is like ceramic brackets are also available, and also post and core, and also in implantology, it has like a surface coating of the implants, and also like now we do have any customized implants within it about which are made up of dental ceramics also. That is like zirconium implants are also available, right? So thereby it has a very much clinical significances. It is not just like a material is available in the market, so we are giving to the technician, and the technician is making the crown and giving us, and we are cementing it back. If we are just doing that without knowing any material science, it is just like a RMP doctor performing prescribing the antibiotics or any kind of drugs, right? So that's why we need to know the material sciences of the agents that we are using in the clinical practices, right? So firstly, it is as it is a very dry topic, I will be explaining you in a historical manner and in story manner so that you can remember and recollect in the exam very easily, right? And also, see, firstly, dental ceramics. The meaning of the ceramics is derived from the Greek word that is kermos, which meaning that burnt stuff. That is like the grave which is burnt, right? The dead body, just like that, we are burning the sintering the molecules. So thereby the ceramic molecules sintered and thereby resulting in a formation of the homogeneous mass. Okay, so that's why it is called as kermos. And coming to the implications, that is like indications and where we are using an advantage are. See, firstly we will be using for the crowns. That is most commonly that we say, but also for the post and core. That is like we also have a customized post and cores with a made up of a post and cores are also available. And coming to the other things, that is like FPDs, bridges, and ceramic brackets, and also dental implants, and also inlays, onlays also are made up with ceramic materials. And thereafter, the composition. See, composition is a very somewhat like a tedious thing that you all people think that it is like a very difficult to remember, but it's like simply you remember that is like a see basic structure. The basic composition of it is a feldspathic porcelain, kaolin, quartz, fillers, and also pigmentations. See, basic pigmentation also like different type. That is like nickel oxide, manganese oxide, copper oxide, cobalt oxide, and also the zirconium oxide also are available to add a pigmentation to the ceramics. And coming to the classification, which is very cringy thing that you all people will be having, right? So that can be explained in a very see. Firstly, you have to understand that systems and chemical structures or the composition have been evolved together. Okay, that is like see, when we think our lifestyle in the before 1940s or before around like before 1980s also, we don't have any mobile, we do have any just only telephones, and also only few people do have any telephones, but nowadays everyone has any mobile phones, right? These are due to because of the advancements in the technologies which has led to the utilization of the products that are available in the market, right? And so thereby now we can now find a person without a mobile phone, right? Why? Because the dependency on this technology has been changed. Similar thing has happened in the dental ceramics also. That is like before 1960, what they used to do, some centuries from centuries time, they have been using the metal crowns, and thereafter they have been using the PFMC crowns. That is like porcelain fused to metal crowns. Okay, so before 1960 they were used. That is like the crown, the metal part is fabricated, casted, over which the ceramic material is layered over it. That is the powder and slurry methods have been mixed. The powder is mixed with the liquid, and thereby they have been added on the metal crown. So thereby they given a tooth color material. But one of the person in the 1960, early 1960, has thought that ceramic has a less strength or more brittle. So why don't we cast it? Is what they thought. So they have went for the castable ceramics. That is Dicor is a castable ceramics. That is like we can place in ceramic pellets, and we can just heat it out and then cast it in the centrifugal machine. Centripetal, centrifugal are the two confusing terms, right? See, centripetal, which has a T in the centripetal, right? So you can understand it towards the center. Centrifugal, away from the center. So thereby it flushes out the ceramic materials outside. So thereby it is adjusted into the mold that we have created after the dewaxing, or what we say is that burnout procedures. Okay, so what is the difficult process that we have incurred, that they have encountered is that they have a difficulty in the fabrication. That is, if you even you want to fabricate a crowns, it takes around 10 to 15 hours to fabricate a single step of crowns, right? So thereby, to overcome this kind of like tedious procedures, and also they require different systems also. So they have thought about, let us move on, and also even after doing this much strain also, they didn't get adequate physical mechanical properties of the die. So thereby they thought that, okay, let us shift to the third part, that is like the pressable ceramics. That is around after the diecast ceramics have been failed in the market. So the pressable ceramics are of different types, which can be like the press IPS and press. IPS and press 2 are the very important things that we currently running in the market also. So you should be IPS Impress 1 and IPS Impress 2. In Impress 1 is made up of in a leucine reinforced, which has a flexural strength of only 160 megapascals. So thereby it has no strength, that is like lesser strength, and thereby they moved on to IPS Empress 2, which is a lithium based. So thereby it has a higher strength of flexural strength, that is around 400 megapascals is present. So it has gained its success in the market, and also it is used in the single crowns in the posterior regions, and also in the anterior regions we can also use for the FPDs. Whereas still there is a lacunae, that is like they cannot use these ceramic crowns in the posterior region because of, so what they have thought is, so let us move to some other systems that are required. So thereby demand and supply both together evolved, and so thereby resulting in a machinable ceramics. See, the main systems, or that is the CAD/CAM systems, have been not devised for the dentistry. They are actually devised for the nuclear sciences. That is like to make any nuclear bombs, they have to depend upon the, so they have designed in a CAD/CAM systems, which have been in the market, sorry, which they have been used in the 1940s time onwards for the nuclear bomb making procedures. So thereby, later on, they have been utilized in the other fields also. So thereby it also found its implications in the medical sciences. First, it has entered into the medical sciences. Thereafter, it entered into dental sciences. Okay, in the early 1980s, what they have came within a CERIC 1, CERIC 2 in the 1994, and CERIC 3 in the 2000s. Okay, so CERIC, what happens in this CAD/CAM system is that they do the scanning of the model, or they do scanning of the intraorally. So thereby it is called as CAD, computer aided designing. After that, once we scan, we have to design it in the computer. So once we design it in the computer, we can just send these details to the milling unit, which mills. That is like, suppose this is a rock, suppose ceramic ingot. Then what happens is they do have any layers of increments. So in this particular layer, if they want to design a star shaped, it will cut in that particular layer as a star shape. Overall, it will become like a three-dimensional object. Like that, it will be milling it. Okay, so thereby these systems have been evolved, but in the CERIC one, it is like less sophisticated. As see, whatever the field that we material that enters into the market in the initial stages will definitely have some lacunae because they are less sophisticated. So in order to fill or overcome this lacunae, what they have designed is that, let us move on to some more advancements, that is like CERIC 2. This is one of the like another milestone that has happened, which has an almost 100% or near to the 100%, but near to the 100% accuracy is present. And also it has materials also have a very good physical mechanical properties and good marginal fit in the patients. And also to achieve this milling process also, they have been designed different kind of materials, that is like, see, Ceris is like ceramic white top blocks are available, which are pre-sintered ceramic white top blocks are available, which can be just milled, and thereby we can cement it. That's a very simple procedure, right? And also the measurable ceramics also has two types. That is like, see, CAD-CAM that we have discussed, and also copper milling system that we have, and also erosion methods are also available. That is, erosion methods of two types. That is sonar erosion and spark erosion. Spark erosion comes under the Procera crowns, and these crowns are very valuable, and that is like a which you can charge even up to like 15,000 per single unit of crown also. Okay. And thereafter, what happened is, in these systems there is one lacuna, that is lot of wastage of the material. Suppose this is a three-dimensional object, then we are milling it, so thereby the particles that are left over or fragmented or broken down are not useful. So thereby, to save economically, what they have implied is to go further another advanced systems, that is 3D printing, that is evolved around the somewhere around early 2000s to even still it is in the evolving stages only, but we have to see like many advances are occurring over a period of time, and now we have any 3D printed models. The 3D printing ceramic also we can be done. That is like, see, 3D printing is also not very difficult thing that you have to understand. It is like, suppose a paper is present, right, which is a two-dimensional paper. So a just a 50 micron layer is is added on a layer. Over that another layer is being added, and then this both layers are sintered together or adhesed together, and another layer added, and they are both sintered together. All the three layers. So thereby what happens? We get a three-dimensional object. See, simple enough. A very good example is paper itself. See, a paper is very thin layer, right? If you go on adding another bunch of papers over it and sinter it together, what happens? You get a three-dimensional object. Similar thing will be happening with the help of a 3D printing, but the sintering is done with the help of a laser. Okay, so these systems and materials are evolved all together. That is like in the previous, that is like conventional powder and slurry methods, which are even used till now also. They are just like a powder mixed with the liquid, so thereby we get in ceramics round. Whereas in the die core, we will be having an ingots. That is, we are casting it. So thereby the systems also evolve like that only. The materials and systems all together developed together. And in order to increase the physico-mechanical properties of these materials, they also went for the incorporation of the materials. That is like zirconium, and atomic number 44 has been utilized for the or incorporated in the dental ceramics. But later on, the zirconium crowns are also available. That is like fully zirconium crowns are also available. Okay, thank you.